Good evening, friends. I'm Dr. Sudhir Sethi. I'm in charge of Dr. Sethi's Heart Center. Our center has been here for more than 50 years, and I'm in the field of cardiology for the last 45 years. Over the years, as I treat patients and I see patients, I've been asked to talk on a topic that is common with all of us. And diabetes and heart disease are two common things that we see in our office every day. As time has gone by, the number of patients who have developed diabetes has gone up at least tenfolds. So, therefore, what is happening is that diabetes is a precursor for developing heart disease the world over. And that's why you see that so many patients who have diabetes also have heart disease. What I'm going to talk to you is tell you how common and how important it is to take care of our heart patients and also take care of the diabetes, which is actually causing the disease, progressively increasing the chances of getting heart attacks, heart failures, and kidney diseases. So I'll start with the slide which you will be able to see. This is the first slide that you see is from Time magazine. So it says, diabetes, are you at risk? Who is getting it? Why is it striking so many of us? And what can you do to fight this disease? Diabetes is a very high risk disease for developing heart disease. Diabetes is also known as a silent killer. Just like hypertension or high blood pressure is known as a silent killer, so is diabetes also a silent killer. It gradually creeps up into your body and takes toll of your heart. Now, how to take care of your heart patients? When you have diabetes and heart disease, the chances of a diabetic patient developing heart disease is 3 to 4 times. 30% of stents that are put in patients are because of patients underlying have diabetes. There are 280,000 heart attacks happening annually because of diabetes and heart disease, and it is 4 times more common in diabetic patients, and 60% chance of dying of heart disease if you have underlying diabetes. So diabetes and heart disease are a fatal combination. So what we need to do is take care of the fact that our diabetic patients' heart is well protected. When I show this slide, what I'm showing is the heart here, which is gradually getting affected by diabetes. It takes years for the diabetes to affect the heart, but definitely it does affect the heart. It's like the iceberg, and only a 10% of the iceberg is shown on top, the rest is all underground. So when I look at the world data, while we have made a lot of progress in protecting patients who get heart attack, people who get stroke, and also making good progress in cancer, but somehow our diabetic patients are increasing the world over, and this is causing more and more heart disease. When you look at this map of the world, you see where are the places which are red is where the diabetes and heart disease is the most. India is among one of them. Second is China, and third is North America. You see rest of the world all over, it's all blue or pink. So the highest number of patients with diabetes and heart disease exist in India. And in India, what we see is the maximum number of patients are in Tamil Nadu, Karnataka, and then Punjab. We are in Punjab, and Punjab is high risk for developing heart disease with and without diabetes. See, when I see the numbers here, in 2019 we had 77 million patients who had diabetes. It is going up to 100 million and then on to 135 million here. 1 million patients with diabetes die of heart attack every year in India. But almost 9%, that means every 9th person who's walking around has diabetes and will develop heart disease. And the other alarming thing is that 44% or 44 million people who have diabetes are not even aware that they are having diabetes. And this is gradually creeping up and causing heart attacks, heart failures. Why is it important to know this? If you have diabetes and heart disease, you lose 15 golden years of your life because the disease takes care of that many years of your life, and those are the golden years when you're around the age of 55 to 60. So you don't want to lose those golden years. That's the time when you are earning the most and you're well established, and it takes a big toll of you. So diabetes as such is a disease of the pancreas. Pancreas have beta cells which produce insulin, which help to control diabetes. Diabetes also runs in the families, very, very important. And why is the diabetes increased so much in the world now? Because of bad habits, overeating, eating the wrong foods, and gaining weight on the wrong places. This is called as visceral fat, fat which is occurring around the abdomen. And similarly in the ladies also, visceral fat and also around the buttocks. So what is happening is this is the kind of picture when you see, you can be quite sure that this patient is going to suffer from heart disease and also increase the chances of becoming diabetic. So how does one know that he has diabetes? There are alarming points that tell you. If you have fatigue, you have drowsiness, you have increased volumes of urine, you put out more urine, intense thirst, excessive, you feel hungry. Despite that, you keep losing weight. You have excessive urine output, and your eyes, you can't focus very well. These are all signs of suggesting that you may be diabetic. It's time to get yourself checked. When I see a patient with diabetes, the commonest thing that happens to a diabetic patient is that he gets heart failure. He or she gets heart failure, gets heart attack, and these are the common things that happen in diabetic patients. So it's not the heart gets involved and also the kidneys get involved. When I see the complications of diabetes, heart disease is about 3 to 4 times more as compared to someone who is not diabetic. Renal disease increases by almost 50% more. So it's very important that a patient who has diabetes will also have complications of heart and kidney. Diabetes is a disease of many comorbid conditions. Diabetes, coronary artery disease, that the arteries are choked, heart failure, and chronic kidney disease. And all these three exist in the same patient. So it is a multiple disease process. Not only heart, the kidneys, and the pump also fails. Majority of patients with diabetes develop cardiovascular disease before they die. Half the patients with cardiovascular disease will develop heart failure before they die. And majority of diabetes and cardiovascular patients will develop chronic kidney disease also. So it's a combination of having arteries choked up, the pump failing, and also having kidney disease. So to understand this, I have a slide which you will. So this is diabetes and what happens over a period of time in diabetic patients. So this is his lifespan. He is losing about 10 to 15 years of his life. His death comes much earlier, 10 to 15 years earlier. And it also shows that as the disease progresses, the arteries get choked, patient develops heart attack, patient has a pump which is failing, it is dilated, the heart gets involved, but 80% of patients with diabetes will develop heart disease, and over a period of time, they will also develop kidney disease. So this is the real story here, that a diabetic patient is at high risk of developing heart disease and kidney disease. So it's basically, in a nutshell, it is the story of pump, that's the heart failure, pipes, that's the arteries getting choked, and filter, that is the kidney. So if you look after the pump, pipes and filters, we are be able to do a very good job with it. With new molecules available, new drugs available, we are now very well able to look after the pump, pipes and filters. So who are the patients who tend to get complications of diabetes? Patients who have had diabetes for more than 10 years, patients who are hypertensive, who are overweight, and who have other comorbid conditions, or have family history of diabetes and heart disease. So what are the targets of treating patients with diabetes? The target is that we look at what is called as HbA1c. This gives you sugar for the last 3 months, an average sugar of it. So we need to focus on this and see that we are able to control the diabetes very well. That's the red flag. So this is the normal values that we are looking at. The green is the normal value that we are looking at. If our HbA1c comes around 6, you should be very happy. If it remains on the red side, you're going to get more and more complications. Higher the HbA1c, more are the complications. As the sugar levels rise, for every 1 degree rise in HbA1c, there is a 17% increase in developing heart disease. So not only should we be protecting the heart, we also need to protect the kidneys with it, because the heart is very much dependent on the kidneys, and so kidneys, if they are protected, the heart will also get protected. So if I look at this data, if you have diabetes, this is the kind of complication you will have. But if you have with diabetes, chronic kidney disease, your mortality, your death rate is so much higher, and the chances of developing heart attack are also much higher. So what is important is that you don't not only look after the diabetes, the heart, the kidney is also very, very important. How do we prevent from becoming diabetic? The important thing is must exercise. Most important is to exercise. Control your blood pressures very well and take low salt. So not only you should cut down on sugars, but also being exercising and also reducing your blood pressure. Undergo regular health checkups. Lower your weight. Limit your sugar intakes and eat more fiber diet. So these are 5 tips for preventing diabetes, basically telling you fiber diet and also try and take more of fibers and exercise. Fresh vegetables, whole grain, fruits are the basic things. Plant-based oils are important like olive oil, peanut oil, safflower, and to name a few. So these are the in crux what it is. Lose weight on your tummy, eat fresh fruits and vegetables and salads, and also do exercises. Depending on your age, if you are young, you can exercise. If you are older, you can do yoga. This is the way of trying to keep your metabolic system in good check. Make the right choices. See, if you go out and don't eat a donut, rather eat an apple. And what are the 5 ABCs of diabetes? Check your HbA1c, that is your 3 months sugar levels. Check your blood pressure regularly. Check your cholesterol well and control it. Quit smoking. Move all the time. Easy on stress. Avoid having stress and know more about yourself so that you can explain to the doctor and doctor can help you. Care of heart is to show your heart some extra love. And by how do you show extra love? By losing weight, exercising, and shake off salt and lose weight on your stomach. It's also very important that when you are diabetic and you are being given some medicines, please take your medicines regularly. Do not change the dosage. Ask your doctor what to do with it. And the important thing is not only high sugar is bad, even low sugar is equally bad. So it's important to keep a very balanced attitude. If you develop low sugars, you will develop these kind of signs which will tell you that your sugars are going low. So most important answer at the end is exercise, eat fruits and vegetables, check your sugar levels regularly. Thank you very much.